Hi, my name is Dr. Fox, licensed psychologist in the state of Texas, and in this video, we're going to talk about explaining BPD and what causes it. So how do you explain a complex concept that you may not fully understand yourself, that worries you, confuses you, and sometimes scares you and frustrates you? So these are common responses to BPD in yourself or seeing it in a loved one. So if you've had that feeling or similar thoughts, I'm going to try to help you in this video as we talk about how to explain BPD and what causes it. Now, please like, share, and subscribe. That's awesome. And let's get into it. Over the years of doing this YouTube channel, I've had a lot of people write me and say, how do I explain to a partner what BPD is when I don't even understand it? How do I explain to my partner, to my parent, even to myself, what this thing called BPD, borderline personality disorder, is? Well, if you're watching this video, you want to know how to better understand and how to explain it for yourself, or how to help a loved one understand what you believe they're going through. Now, the father of BPD, his name is John Gunderson, and he has since passed away. And he explained BPD best with insight, clarity, and compassion. So I'm going to read some statements from his book. It's a clinician's guide for borderline personality disorder. It came out in 2008. And what I really like about this is that I think that it is succinct as you can be. But I think that it also communicates not only what the issue of someone with BPD, of what they're going through and what they're experiencing, but also it relays this sense of compassion. It relays this sense of confusion. And I think that it gives a greater sense of that it's not a willful reaction. It's not like folks are sitting there saying, how can I really destroy your life today? I think that there is a misconception of volitionality, of this direct and clear intent to destroy someone else, to destroy their life, things like that. And I'm not saying there aren't people out there who do that. There certainly are. That falls more into the antisocial personality category than it does your BPD category. And sometimes, and regretfully, that those are confused. And I mean, I'd be happy to do a video on that if you're interested, but let's get into, so John Gunderson. So this is a quote right from that book. What I'm going to do is, as I read it, I'll have it kind of scroll up on the page so you can see it as well, and hopefully that this helps you. So I'm going to read directly what he wrote. And he wrote, people with BPD are born with a genetic disposition to be emotional, have low frustration tolerance, and be very sensitive to signs of rejection. They have grown up feeling that they were unfairly treated and that they did not get the attention or care they needed. They are angry about that, and as young adults, they set out in search of someone who can make up to them for what they feel is missing. When they think that they have found such a person, they set in motion intense, exclusive relationships, which predictably will fail because they place unrealistic expectations on the other person. Upon failing, they feel rejected or abandoned, and either their rage about being treated unfairly gets reawakened, or they feel they are bad and deserved the rejection, in which case they become suicidal or self-destructive. Sometimes their anger about being mistreated causes others to feel guilty, and sometimes their self-destructiveness evokes protective feelings in others. Such guilty or rescuing responses from others validate the borderline person's often unrealistically negative perceptions of mistreatment and encourages their unrealistically high expectations of having their needs met. Thus, the cycle is apt to repeat itself. Now, feel free to rewind that a little bit and listen to it a few times. Really kind of, let it kind of set in about what it means, what he's saying. That expression, I think that he eloquently really does describe what's going on. Now, he also explains, which I think is really important because a lot of folks have asked me this as well, he explains in the same eloquent fashion what causes BPD. And this is from the same book. So again, I'll read it here and I'll have it kind of, scroll up on the page as I read it so that you can get a sense of what I'm reading and you can read it along with me. Okay? The cause of BPD is not fully understood. but we know it involves multiple factors. Like all other major psychiatric disorders, BPD arises when an individual with a genetic predisposition is exposed to environmental stressors. Although the genetic predisposition is still being researched, we believe that this involves 3 personality dimensions, each of which has multiple genes. These dimensions, called phenotypes, involve affective or emotional instability, impulsivity, and interpersonal rejection hypersensitivity. The environmental stressors that lead to the diagnosis are highly variable from one individual to another. However, for many individuals, histories of neglect or trauma during childhood are highly relevant. Research is beginning to tie the 3 personality dimensions or phenotypes to neurobiological pathways. Neuroimaging studies suggest that the emotional gateway within the brain, the amygdala, is overly active, whereas the normal inhibitory system within the brain, the prefrontal cortex, is hypoactive. Although much more research needs to be done, no one cause is adequate to explain the diagnosis of BPD. So I don't want you to get lost. I know that he's talking a lot about neuroimaging. He's talking a lot about the neurological factors, certainly, and all of those components. So it's important to remember that as well, and it can get really confusing. So let me put these 2 incredible statements in a nutshell for you. And what he's saying is that BPD is the combination of genetics and environment that make it hard to feel love and even harder when you feel rejected. It is a constant search for connection when you don't know what the connection is. It's a sense of loneliness and fear without knowing exactly where it comes from or where you're going with it. The tidal wave of thoughts, emotions, beliefs, and memories evoke self-destructive means to try and resolve or calm the tidal wave without having the necessary skills to do so. Over time, this becomes a cyclical habit out of something we don't fully understand, but it disrupts emotional, behavioral, interpersonal, and identity aspects of your life. It's complex, but treatable, and hope should be in the forefront as you seek and engage in treatment to outgrow all the things you once believed you couldn't. Please replay that over and over. If someone in your life you believe has BPD traits or borderline personality disorder, the full disorder, please listen to what that says. Please get as much as you can out of that so you understand it. Because those with BPD, it is a hard life for them. It is difficult. But I have found over and over and over again, as much as they are self-destructive, they're in an awful lot of pain. But once we turn down that pain and reduce those maladaptive behaviors of self-destruction, they grow and develop into the most amazing people that they then embrace their talents, they embrace their ideas, and they give us as a society, as a world, amazing things, whether it's in the arts or whether it's in engineering or whether it's in science or whether it's in psychology or psychiatry. So I hope that this has answered some questions for you, and I hope that you have found this helpful. I wish you all the best. Please be well, and please like, share, and subscribe. Thanks. Please take care, and bye-bye.